We went to U.S. Congressman Tony Gonzalez, and we hired an architect, and the architect built these very elaborate plans for a 48-bed psychiatric hospital. We asked Congressman Gonzalez to make a request of Congress. I guess what used to be called earmarks, they're called something differently now. For $25 million for this hospital. Tony Gonzalez put in the request through whatever channel they put those requests through in Congress. And of the $25 million request, we got notification that we would get $2 million in funding. Well, $2 million is nice, but it's not $25 million, and it's not going to build a $25 million facility. So we were short a lot of money. And when I got here, I was pretty nervous about us running a psychiatric hospital. I was like, well, we're not really in the hospital business. So I went to the mayor at the time, Mayor County Judge, and said, hey, you're only getting $2 million. We have to pare down these plans. I got to go find a lot more money. Why don't we shoot for maybe a $10, $12 million facility? We'll make it a 16-bed adults crisis stabilization unit. And they said, okay, let's go. And then the shooting happened. And in the immediate aftermath of the shooting, when the governor came through, and I'm pretty sure I'm accurate on this, and the governor asked Mayor McLaughlin, what can I do to support you? And Don McLaughlin said, we want money for a psychiatric facility. And the governor said, okay, we'll see what we can do. So the governor then, I don't know if you remember, in the aftermath of the shooting, there was like an emergency held legislative session, and they talked about gun safety and they talked about mental health. And they pumped a lot of money out. And the governor at that time ordered, we as the local mental health authority, Hill Country Mental Health and Development Disabilities, that we would conduct a needs assessment for the mental health needs of the region. And so we hired the Meadows Mental Health Policy Institute. And Meadows is based, I think they're based in Austin. They do these needs assessments all over the state. And usually when some community wants a facility, they will hire Meadows to do the needs assessment, which will solidify the need. You can be a community and say you want one, but unless it's widely justifying the need by a formal assessment, you likely won't get funding. So Meadows did this needs assessment, and out of that came a recommendation, and the needs assessment was completed, and I submitted it to the Texas legislature just prior to the last legislative session, which was 2 years ago in January. And long story short, the 88th legislature gave us $30 million to build a psychiatric campus, which all these folks went to the groundbreaking of. Some others of you may have attended. There was an article about it in the newspaper. And the legislature gave us $30 million to build a psychiatric campus, to relocate our existing outpatient program into the new campus. And long story short, we've got architects, we have renderings, a 50,000 square foot facility, which will consist of 2 16-bed crisis units, one for adults and one for children and adolescents. And so the city donated 7.5 acres of land to us. It sits right next to the Fairplex. That big old, huge, we got 7 acres right on the corner there. And we had a nice groundbreaking a couple months ago, or 6, whatever it was. And the state legislature gave us the $30 million. We got the $2 million thanks to Congressman Gonzalez's efforts. And then the legislature also gave us $3.5 million for furniture and equipment. Another recommendation of the Meadows Needs Assessment was there was concern around workforce. And specifically, they said that a behavioral health technician certification program should be created in partnership Hill Country Mental Health and Southwest Texas Junior College, and that will help with your workforce issues. So we said, well, that sounds like a good idea, and then we went off and met with President Gonzalez, and now here we are today. And so the state then funded us. In the aftermath of the shooting, they gave us more money for outpatient services. In line with the psychiatric campus, we have an outpatient staff right now in our clinic. It's about 30 employees. With the psychiatric campus coming, we're going to have 100 new jobs. So we'll be up of a workforce around 130 in Uvalde, specifically the mental health. And so they funding for an outpatient expansion And in those dollars were some of the monies which funded the scholarships in this partnership with the school here, but then also funding for the operational funds for this campus. Of course, they gave us the money for bricks and mortar, but we needed money to staff for these 100 employees. So the state legislature gave us those funds as well. And so we are probably, I don't know, about 16 months out from when we will occupy, when it'll all be built. We have the groundbreaking ceremony. And so I thought that would be, you know, it'd be good for you to hear that background about how all this came together. This was, you know, this was in the aftermath of the tragedy. And it has resulted in a pretty substantial amount of funding for us for mental health services. And so, one of the things I want to mention, I was asked to make some comments about, you know, your particular area of interest, which is behavioral health care. And is that I think this is the golden moment for mental health care, not only here locally, but nationally. And there is wider acceptance amongst the population of people who have mental illnesses. Stigma is reducing by the day. And we all know somebody. We've all got people in our family. We've got loved ones. You know, we may have issues ourselves of people who have a mental illness. And so the importance locally in the community is critical, that there be acceptance. And like I said, we're seeing stigma lift every day. Behavioral health is a wonderful career. I have spent my whole career in it. I've spent most of my career working at the community level, working for, you know, community mental health center. I started out 40 years ago as a direct service professional. Those are some of the jobs that hopefully you will come to work for us in the new behavioral health campus when it is live. And so, you know, my path started, I was working a 3 to 11 shift. I was making $5.05 an hour in the mid-1980s while I went to graduate school during the day, and I worked the 3 to 11 shift and then the midnight 7 a.m. shift. And then, you know, I got a master's degree in social work, and then I went to business school and got a master's degree in healthcare administration, and I've spent exactly half my career, 20 years, as the CEO of a community mental health center. So once upon a time, I started very, very, very entry level. And I was not like I got an MBA and jettisoned into something. I was making $5.05 an hour. And I think the minimum wage was just a little bit below that then. And so I think my words of encouragement to you are, now that you have the certification, an email, and we can start the work. You'll have to go through a formal interviewing process and background checks and all that sort of stuff. And if all that goes well, then you'll come to work for Hill Country Mental Health 16 months before the campus even opens, and hopefully we can start plugging you into shifts. You'll go through all our training. And so, you know, basically, you got jobs. And you will be able to gain experience. So that is my offer to you. President Gonzalez, good job for saying yes whenever we met in your office. And again, you know, I just want to say, this really is, it's the golden era. And in all the years that I've worked in community behavioral health care, I've never seen wider acceptance, and I've never seen the funding flow the way it is flowing right now. And you know, the tragedy was horrific, of course, this community more than any, but it, you know, Uvalde is well known in all throughout the country. And I've got friends, you know, I'm from New York, and I'm in communication all the time. Who are always, you know, sending me newspaper articles from up there about something related to Uvalde. And you know, as tragic and sad as it is, that, you know, that these dollars that have funded your participation in this program, which will fund this campus, which will fund expansion of mental health services in this area, well, that's a very positive thing. In addition to the campus, in our outpatient, we've got other positions that are coming. So, like I shared with you, once upon a time, I started as a DSP, working a 3 to 11 shift with teenagers who had severe problems. And then I got a master's degree in social work, and then a master's degree in healthcare administration, and then I became a CEO running one of these agencies. So, you got to get counties that were included in this needs assessment and this campus that will be coming. There will be a ribbon cutting whenever it's done, and you can all come. So just, anyway, thank you.
Thank you so much, Mr. Todd Citron. Up next, we have our class representative, Alisa Ramirez.
So we can kill all the stuff down there.
Good morning, everyone. Thank you for coming. We gathered here today to celebrate the journey that started on our first day of class, a journey of teaching, sharing, collaborating, and determination. 13 strangers with one major thing in common, our passion for mental health. Very quickly, these strangers became friends. We spent a total of 143 hours listening to lectures. We discussed each topic, dissected topics, and we dived into the depths of mental health. We laughed, cried, and we leaned on each other when we had very difficult days. We shared very personal stories of our lives. Sometimes we shared a little too much. But those were my favorite days. We listened to each other. We listened to our stories without passing judgment, and we were present for one another. Without us even knowing, we were already practicing the art of a mental health technician. As Matt Higgs once said, mental health problems do not define who you are. They are something you experience. You walk in the rain and you feel the rain, but you are not the rain. Lastly, I want to give a special recognition to Ms. Salas, who gave up her time and energy for us. She has been the greatest pillar for us becoming mental health technicians. Not only did we succeed academically, but she also taught us how to reach our highest potential with coming into contact with patients. Ms. Salas, we thank you for all that you've taught us, for always answering our random phone calls during the day and night. And we are very blessed, and people are very lucky that they have you as a teacher in this program. Southwest Texas Junior College did a great job in hiring you. Thank you.
Thank you. Thank you, Ms. Alisa Ramirez. And I too want to thank Ms. Salas for her wonderful work in this class. With that, we are gonna move to the presentation of certificates. Dr. Gonzalez, do you want to join us on stage?
Okay, our first
first graduate, Ruben Chavez Vega. Miss Bonnie Herndon. Jessica Johnson. Rola Kelly. Celinda Martinez. Gabriela Mata. April Page. Patricia Perez. Valeria Pina. Alyssa Ramirez. Carmen Ramos. Imelda Tabares.
A big round of applause for our graduates. And with that, we conclude our graduation ceremony and we open up the stage for everybody to come and take pictures with our graduates. And we would like to have a class picture with the folks from Hill Country and our school administrators first. And then we welcome everybody to come and take pictures with your family member. Thank you.